Morning and welcome to the next in our series, webinar series, Surviving COVID-19, Physical and Mental Health. On behalf of the Brazilian American Chamber, I welcome you, but I also hope that you're all doing well, keeping safe, keeping healthy, and certainly our two guests will help us in that endeavor. We first have Dr. Roberto de Paula. They're going to discuss the adverse medical and psychological effects of COVID-19. He is currently a consultant, but has been practicing in the United States, although a Brazilian psychiatrist for 50 years at some of the top institutions, especially in the New York area. Dr. de Paula received his medical degree at the University of Brasília Medical School in Brazil and has received numerous merit awards. The list is so long, we'd be here all day sort of telling, and medals from the Brazilian government. Also, he's published extensively on a number of subjects in medical journals. Drica Pinotti is our other guest. She started a beautiful website that she's going to talk about in support for people that are dealing with COVID-19 in the New York area. Also Brazilian. She's a Brazilian-born author with 15 books published in Brazil, Portugal, and the United States. Most recently founded the Epidemic Support, which is the platform she's going to talk about today to help with the COVID-19 crisis. Welcome all of you. And before I turn the microphone off to Dr. de Paula, I just want to say we're going to take questions. They're going to give their respective presentations. If you would please, if you have questions, put them into the chat at the bottom of your screen. It says Q&A, and we will answer them accordingly. Depending upon how they come in and where they come in. But please feel free to ask your questions there, and we will get to them when we get to the question and answer session. So without further ado, I have the honor of giving the microphone to Dr. Roberto de Paula. Dr. de Paula.
Oh, thank you very much, John. First of all, I want to thank the Brazilian American Chamber of Commerce and the administration for getting us together and putting different people with different knowledge to discuss this very difficult crisis we're going through. And what I would start saying that crises are part of our life anyway. I mean, we go and we experience in our personal lives and throughout growing up, but we respond in an individual manner and based upon the intensity we feel appropriate for the circumstance. Now, already in our childhood, going back many, many years, of course, we attempt to overcome the usual fears, like ghost stories, horror movies, whatever, situations that we know and learn mechanism of reassurance to avoid and block a possible, what would be a panic state. Nonetheless, these defense mechanisms not necessarily work at our satisfaction all the time. We end up having to reevaluate and all the frightful circumstances and try other ways constantly and progressively to our needed level of tranquility and peace. In reality, with the maturity of our lives learning coping mechanisms, we always improve with the natural process of aging. However, we always carry little bits of wounds that do not heal properly at times, and they come back. So we are going now more than ever to one of the major health crises that perhaps nobody ever experienced in our lifetime. We are dealing with physical and psychological threats of this COVID-19 that is an invisible adversary that triggers increased fear in people's minds. And this can be very difficult to adjust and absorb and deal with it at all times. The presence of this major crisis can exacerbate both positive and negative ways of dealing with our inner self. Individuals, they use their own acquired processes throughout their life and have a very personal response. And some would use ways to combine meditation, physical and respiratory exercises, and it's sometimes works, sometimes doesn't. The question though is how to deal with the situation when it becomes really unbearable. Now, what I'm going to be talking about is, of course, the extreme condition, which we call in medicine depression. Now, depression is not sadness. Depression is a medical condition that we evaluate and affect our daily functioning. It can be very painful. It can be very even contagious. You know, people don't like to be around people, depressed people. We all have a little bit of uncomfortable feelings when we see somebody who is severely depressed. But the lack of joy is the initial feeling with levels of apathy, you know, lack of motivation. We try to deal with that the best we can, but this most difficult symptom, in a sense, is really the fear of losing control. And this can be perceived as, you know, some people, and we all call that anxiety. Now, anxiety can increase, can be very difficult, and it can be accompanied by negative thoughts, irrational fears, and it can escalate to a level that can, and sometimes, believe me or not, that people end up in the emergency room because their body starts talking for them. They have, you know, respiratory changes, you know, the tachycardia, you know, the heart beating very fast, the difficulty control. So this is the extreme situation. But the situation can be so aggravated that one also feels one particular symptom, which is very dangerous, and that is a high level of irritability and anger, literally. This anger can be displaced in appropriate ways and sometimes not so much. Sometimes can be, and the danger is always that people will either introject, in other words, turn against oneself, or get it out, and sometimes hurting people, ironically, to people around us, people that we love. So these are symptoms that are then really extremes, and already just cautioning people, of course, that hopefully never happens to any of us, but it can happen. And people around us are the ones who perceive it faster because they are observing and they see how we respond. Now, when we observe symptoms like that, of course, we should also consider that we should not be judgmental. You know, it's a situation that it's really almost like a biochemical imbalance in one's body, that, you know, it's exacerbated, it's presented because of what we call depression. Now, this is, of course, dealt through treatment, medical treatment, which includes sometimes medication or medication and therapy combined, but that's the way we should just be aware. So I'm going a little bit overboard with talking about these very, very difficult moments, because we want to be making sure that, you know, we are aware of what happens to our own self. Now, on the level of what should we do about this, we should always fight the situation of isolation and the crisis with optimism. We have to see that crisis in so many ways equals opportunities. So we should try to reinvent ourselves in different ways, try to look at the world, and this will definitely happen, that, you know, work activities will change, the social relations will change. All these things will be part of a situation that we should look at it with optimism. You know, even business-wise, people will reinvent themselves. Even in medicine, medicine will definitely change the way we practice. What we're doing right now, which is that would be considered telemedicine, it's already being used by hospitals. And this is something which is going to become a normalcy for everybody who's in medicine. You don't have to move around to see your doctor. You can, if necessary, we'll be able, mainly in my specialty is psychiatry, that I don't need to do any major physical examination. You know, this will be a norm. So that's the way things will go. But if we maintain our level of optimism and look at our talents to reinvent ourselves, to be able to use things that we perhaps do to work, responsibilities, we could never done that before, but suddenly we have the time, so we can do it. And I think we should try to help other people also. You know, this is another way to reach out, and Drica will probably be more, you know, able to explain what can be offered, what can be done, but it will always give a feeling of being active, being participant, and giving some of your talent can be used for other people. All right. So we're open for questions.
Thank you very much, Dr. De Paula. To remind everybody, please submit your questions on the chat that's at the bottom. It says Q&A. And let me turn it over to Drica Pinotti. Drica.
Hi. It's a pleasure to be here. Not really. I'd like to not experience this moment, but I'm glad I can help a little bit with the things that can help our community. At the day one, when the governor say, okay, we need to stay home to stop the contamination, I was thinking with myself. At the same day, I had one therapy session with my therapist for other reasons, and I told him, oh my God, if I am here doing therapy for another questions that I have about myself, I want to improve myself, I can imagine how it will be when everybody's need to stay home and eventually lose the job or work from home with 3 kids, or anyway, the situation is so complicated. I can see how crazy it will be. So I start thinking about do something. What could I do to help people? And I call a couple of friends and say, I need to do something. Let's try to do something, because I know so many people, and I think we can help in any kind of way. So we start thinking about what we should do, and we realize very fast that emotional support could be something that people really need at this moment. Of course, they need food, they need money to survive this time, they need jobs, but emotional support is a big part of this show. People need to be mental health to get everything else. So we built the platform. We have one amazing team of supporters, women that are very strong voices in our community. We get together to put this project, give life to this project. Epidemic support basically is the practice. We try to inspire people to practice the social outreach, because it's not a moment to be selfish. It's not a moment to think about themselves. It's a moment to stay home to save others, to connect with others, to online virtually, to check out if they are fine, if everything is okay, or if there's something that we can help, even in a distance, even separate, we need to try to keep together. So that is what we are trying to do. We are trying to connect people. The only tool we have right now, and the most powerful, is the internet. It's virtual meetings, virtual talking. So it's a very, very important and very powerful. So the platform is offering basically 3 services today. That's emotional support for individuals. So we are connecting someone in need of talk, need some kind of emotional help from one professional. So we got some, we have some volunteers. We are trying to connect them with people that need that. The other things we are doing is emotional support, but for group of people with the same issue. For example, now we have a group of pregnant women that are very scared, that they are they're going to delivery very soon, and in this moment, and it's so uncertain what's going to happen, if they can have someone in the hospital with them. So it's a very anxious moment for them. Something that could be so special now is kind of falling apart, the dream, the moment. So we have a group of support for these ladies too. The other thing we are trying to do is friendly calls. Like if someone is very feeling lonely, overwhelmed of the situation, and don't have families or friends around, we are calling them and say, hi, let's talk about anything, TV shows, movies, books. Let's take out the attention of this moment and try to talk about something else that make you feel a little better. The other thing we are offering is yoga and meditation classes. Again, because we need to be active, we need to exercise, not just mind, but the body as well. So that's what we are trying to do. That's what we are trying to do. And we have a couple videos as well. We are asking to people, a couple voices of our community, send us video to inspire people with good message, with positivity, because that's what we need right now. Our platform, everything we offer is for free. We don't charge for the service. We don't ask donation. And the volunteers are giving us the precious times they have, because they are busy too. Dr. Robert, I think, knows that they therapists right now are very busy. So if they offer us 1 hour per week, 2, 3, 5 hours a week, we are very happy to. We really appreciate, because it's hard to get people in this area, in this field, that still have time to give. So it's very precious for us. So that's what we are doing for now. We are trying to help people. The platform is just for this moment, the crisis moment. We don't know about the future, but we started 10 days ago, and our plan is trying to help until the last day of the isolation. After that, I hope everybody get better and come back to life, to regular life. That's what we are doing.
That's great, Drica. Let me start off with a question. We haven't gotten any. Please, if you have questions, submit them on the tab that's at the bottom of your screen. This is also to both of you. I mean, where have you seen the most success? I guess everyone's different in terms of dealing with it. Like we were discussing before, I take some solace in looking at numbers. Other people don't take solace in looking at numbers. Some people don't want to watch the news. What do you think, in terms of, and then also, Drica, in terms of the support you've been giving so far, how have been most of the people you've been dealing with deal with this in one way or another? Like you said, Dr. Paula, keep active and things like that, but I just want to be able to, if you could be a little more specific on some of the things that you've encountered.
John, okay, Drica, go ahead. That's okay.
For us, we are giving them just one emergency support, right? We are talking to people who are freaking out right now with a specific problem. And we cannot promise long-term therapy or anything, but one moment where they can talk about their problems, and our therapists are trying to make them feel better. Our therapists are volunteers, are licensed people, so they are professional. And I think that's what we can do for now. It's not a long-term therapies or anything like that. It's just for the emergency moment.
My feeling is that we are all individuals. We're all different. Like I said previously, we all adjust and cope with the stress in a very particular way. So in contact like this, it's always important to identify what's the most difficult point in one's life to cope. It's either financial, either family. It's something that one can explore during the initial contact. Of course, you know, even the financial aspect. When I spoke about people using their own talents, of course, a lot of people, like Drica mentioned, are going through financial issues. And sometimes somebody who's an expert, you know, as we have so many in our Brazilian American Chamber of Commerce, could be helpful to guide the person through and how to better deal with that, the uncertainty of the future, etc. But again, it's reassurance. You know, that's what we're talking about. We are constantly dealing with fear. Which includes the loss of control. We're living in a prior to the crisis, in a situation that we had built safety mechanisms around us, and suddenly these mechanisms are taken away, and we are on our own, in a sense. I mean, we're isolated, and not everybody, and we just alone with our negative thoughts, our fears. So that's one thing that one needs constant. It's very important for one to understand how he or she is coping with the situation.
Thank you. We do have a question from the attendees. How best should we transition psychologically from the short run, that is one day at a time, I can get through this, to the intermediate run, the uncertainty of what life will look like in 6 months, 1 year?
Well, that's a very important question, because, you know, it's a very personal thing. Again, we have to try to be optimistic depending on your professional role. You know, one will have to really adjust to see how you can do something the same way, probably not, but reinventing in different directions. The issue of whatever one was doing previously does not necessarily mean that it's going to be like that, not only for you, the person, but to everybody. This will change our lives. And we have to be optimistic and think about, you know, how can I do the same thing in a different way? How can I apply my knowledge in a way that can be constructive and, at the end of the day, give me pleasure and satisfaction that will alleviate my feelings of, you know, depression.
Drica, what have you encountered in this sort of transition when you, I mean, you're trying to, many of the things are to sort people to help them get through this, stay calm and so forth, but have you come across any sort of medium term issues with the different things, with the different programs you're offering people?
We are trying to, actually, I'm not a therapist, I'm not attending them. So we are trying to do exactly what the doctors say, like bring them to the positivity, try to think that it's gonna end, it's gonna end, it's gonna end. I hope it's gonna end soon. So we need to keep ourselves strong, and we need to keep ourselves strong and productive, and in trying to be calm. And I think what I am trying to do, I personally trying to do, is inspire them to do exactly what I'm doing. This platform is helping me personally to reinvent myself, to feel good about doing something to others, and do not focus so much in the problem that we are having today, because everybody's in the same page, right? Everybody's in the exactly same page, and it's unique. So what I can do to reinvent myself, to feel positive and to be strong, because at a certain point I will open the door and I'm going outside, and life will start over again. And at this moment, I want to feel good about what I did when I was isolated. I want to feel good about it. I don't want to think like, oh, I was down and pessimist or sleeping all the time because I have no hope. Or I know it's very hard. I know it's a very hard moment, but I do think we need to keep our mind health. I do think we need to prepare ourselves for the next moment in life when we can open the door. And that's what we are trying to inspire others to do as well.
You know, what Drica just, if I can add something, her work is really very helpful to connect people, professional people, to those who actually need some assistance. Now, the point that I tried to make before is like a physician, a trained physician. You know, my major gratification has always been to be able to be helpful, to alleviate people's pain, either physical or emotional. So, you know, one should look into oneself and say, what talent do I have that perhaps I can spread it out? At the moment that you get feeling of being useful, you know, not because, you know, when you lose a position, either by the socialization at work, whatever, you feel a little bit like not that useful anymore. You're alone, you're home, you don't see anybody. But if you find it within oneself, you know, what talent perhaps I can displace to a level where people would be, you know, I would be able to really help other people, that's extremely gratifying. And when you're getting some thank you, which is not very often you do, but when it does, it's extremely, extremely gratifying. Okay, that's pretty much what I think.
Okay, after fumbling around with this, I have been able to put up, and I wanted to make it smaller so you could see Drica's the website name. It's epidemicsupport.com, and this is her website, and you can see, as she was talking about, there's a number of places where you can find emotional support, and she brought in yoga and meditation, inspiration, and call. So you can see that it's pretty full menu of things where you can ask for help. The other thing is that Dr. Paula has volunteered. There are places to volunteer if you feel like you want to help out as well. So it's really quite useful. Sorry, I should have had this up earlier, Drica, and then was filling around to be able. I couldn't see the website address just to make sure. So we're sharing that.
Yeah, people can sign up for being a volunteer on top, or if they need help, just fill the form and we'll contact them. Carla is one of our supporters.
I have a question for both of you as well, and Dr. DePaula, since one of your focuses is children. And also, Drica, if you could talk about maybe the support you give for families and so forth. Roberto, would you give us, you know, what you think in terms of how do we help our children through this? Most of them are all, you know, studying remotely and doing homework and things like that, but it does take its toll. So let me turn that back over to you both on that question.
Well, by my position about that, of course, you realize that they don't understand what the heck is going on. I mean, this is a totally new, because it's an invisible threat. It's something that, depending on the age level of a child, he or she will never perceive as something that, you know, it's there. They are only focusing, like most of us, on the losses of going to school, the socialization in school. So these are things that, you know, depending on the situation, of course, parents should be able to get around and set up a routine with activities throughout the day. But, you know, at the end of the day, I mean, we're talking already, you know, it's almost like almost 4 weeks of isolation we have. And that can be difficult. Kids can become difficult to manage. in the sense of getting easily frustrated, getting some behavioral issues. It's not that different from us. It's just that we have to be understanding and supportive to help them to go through the crisis. But a routine and even building up activities, some things that, people, we couldn't do it because of our work activity outside of the house. You can set up some time to teach something new, invent something new, stories, depends on the age level. So when the kids can understand a little bit that it's gonna take a little longer. The isolation is something that it's necessary because of a condition which is affecting, but they are safe. That's the most important thing. They are safe. They are at home and they're with the parents and they are safe.
I guess I shared a little too much there. Sorry about that. We're trying to coordinate everything to make sure everything is going smoothly. Another question comes from this, sort of a derivative of what I asked before, but some people are worried about what they should follow. One of the questions came in and asked, he doesn't want to follow certain types of data, especially like deaths and so forth. And another asked something similar. They asked the following: it's very depressing to think if we pass on these days, you may die alone, be cremated. Ceremonies are all online, remote. There's so many people without family in New York as well, and this is more of an appeal, it's more than a question, just it breaks their heart in this way. And maybe you have some thing to say about that. Also, Drica, if you want to, you talk a little bit more about your inspirational videos and where she can see them. We did put the website. I'll put it back up without putting all the other stuff I was doing on there. Sorry about that. Also, another one of the audience says they have their own stories and they would really like to meet you as well. We have a number of people talking about volunteering, and that is another way to feel like they're just not stagnant sitting in their room. So let me turn that back over to you, and I'll bring your website back up again.
About the inspirational videos, we are asking our community to send us videos to inspire others. So you can record yourself in your house, or a message, or what you were doing, for example, with your kids, what you're doing with your kids that make the energy flowing well and everything peaceful and fun at this moment, what you're doing. So that's what we are asking people. Send us the video. The video can go, you can make a video with maximum 5 minutes, because more than that is a little heavy for our platform. And send to us. We have the email on the website, people can see. Just record yourself, or if you want to give a message, tell us how you feel, how you think, things that you find out in this isolation moment can help others. For now, we are asking the strong voice of the community to give us the videos, but we are open for everyone to send the videos to us. And the other thing is about being a volunteer. Everybody is welcome to be a volunteer. We have a couples service. Of course, to be a therapist, need to be a licensed therapist. We need professional people for this function, but for friendly call, for example, everyone can can give the other person a call and say hi, right? So we are welcome to everyone who wants to making friendly calls. The video as well, everyone can send a video to us to inspire others. Yoga instructors and meditation instructors need to be licensed as well. So, but everybody's welcome.
Well, we already see that, this crisis is creating a new environment, where people, just by dealing with or connecting themselves with each other, one should never forget that we're all, as being, I'm talking about, of course, the Brazilian American immigrants, we have left behind, a supportive family or not, but there were people that, we grew up with. And at the end of the day, fortunately, we can still connect much easier with Brazil and the culture, et cetera, through, WhatsApp. But, it's still, ironically, what I see these days as in an older generation is that the tendency is for people to avoid and even not to use the social contact as much as they should. And this is something for us to reevaluate for the future. Do we want to have that, or would we like to have a more socialization, in a sense of people getting together, discussing issues, and not only being involved with the daily professional activity. We should think also about our less, favorite class of our society, the people who are immigrants who don't have anybody around, and they might be going through, their particular stress exacerbated even by financial loss of jobs, et cetera, et cetera. So all these things basically reinforce the need to have an organization as the Epidemic Support, which I hope can last beyond the crisis, okay?
Good. Yeah, and this is maybe more a question for Dr. Paula. I think sometimes, as difficult as information on this is, I guess emotionally and psychologically, the imagination can be worse, right? And I don't know how you make a balance. I mean, I guess it depends on the individuals. So, the question is really, again, you have to keep yourself informed, but sometimes that becomes a really sort of difficult thing to do. And I think the recommendations that both of you are making in terms of keeping active and so forth are really, really excellent ones. But, in the end, I think we have to know what's coming next. So perhaps you can give us some guideposts as to how to do that.
Well, this is what we've been talking about, which is the isolation and all the media available. It provides some information, which some of them are facts, others a little bit distorted. But at the end of the day, it really feeds us in our fears. I mean, we always look throughout our lives for feelings of safety and protection. And suddenly you're dealing with something that you're questioning. Is this right? Is this going to be, can this affect me? So we have to fight the negative thoughts. And one way to do it is to try to focus into another matter. And whenever you feel overwhelmed by these fears, one has to really look into oneself and say, hey, let me do something. Let me feel active in an area where I feel that I have the control. Because, we're only getting information, and information, through the media or through friends are feeding into these negative thoughts. So we should basically try to acquire and look into each one of us to see what is something that I feel comfortable doing, that I feel that I'm able and can feel that I have the control. And that's when I say, reaching out or doing something which you you'll be part of a group like, Drica's organization. You can help the emotional component, but also you have other talents, other things, personal talents that one should be able to say, hey, perhaps this would be helpful to other people. In other words, the best way is really to look outside, to imagine, well, if I'm in such a pain and I have such a good, or, at least I survived so many years, I'm doing well, why don't I use this to help others? It's a suggestion.
We have a specific question for Drica. Where can we watch the epidemic support videos? I know there's an email on the website. Is it on YouTube, Instagram, or just on the website? Where do you have access to your inspirational videos?
Yeah, we have a couple of videos at the website, and we have the complete list of videos on YouTube. We have a YouTube channel, Epidemic Support, and we have the Instagram as well. On Instagram, we post one video a day. So every day we go there and have a new video on Instagram. The complete list you can find on YouTube. And I would like to say the other thing that I just forgot. We are trying to help people in Portuguese, English, and Spanish. We are trying to have the support in all of those 3 languages.
Very good. That's excellent. Well, we're going to wind up. We have no more questions for the panel, but maybe each of you can give us a final word on this. And I know everybody, we've heard from a number of people that have already volunteered, already people that are interested in volunteering on the chat and so forth. But if there's no more questions, maybe each of you can give a closing statement. So Dr. De Paula.
Okay, so I really think this has been a very helpful, and for the first time in all the years that I've been in New York, it's the first time that I really see people reaching out and trying to help, fellow Brazilian Americans. And again, like I said, crisis equals opportunity. You have to look at what we've lost, yes, but what's available? What can we do out of our own to really make things easier for the whole community? And believe me, there's a lot we can do. Okay, thank you very much, for being part of the panel, and I'm always available.
Go ahead.
Yeah. Well, I just want to say that Epidemic Support is here to help you guys. If you need help, come to us. We are going to try to help you with the emotional support, friendly calls, and yoga and meditation classes. I want to say thank you for our team. We have a great team of supporters and coordinators. That the team is big, so I will not say our names here because I will forget someone, but because we have a big team right now. I want to say welcome to volunteers. Please come to help us. And I want to tell people that if you need help, do not be shy. Please come to talk to us, because the service is free, is confidential. The only person who will get in contact with you and have your phone number or your email is the coordinator of the area and the therapist. So come to talk to us, because we know you need help, and we are here to help you. We are gonna try do everything possible, everything we can to help our community right now with this crisis. And I hope everybody stay home, stay safe, and healthy. Thank you.
Thank you very much, Drica. I want to thank you both, Dr. De Paula and Drica, for reaching out and really providing a really nice discourse and a really nice webinar. And so that everyone knows, we'll be posting this video of the webinar on our website, and You can play it or send it to your friends and so forth and so on. And if you need contact other than the website and so forth, we'll be happy to provide them. But I wanted to thank you both and all of you who are on this call for joining us today. Really excellent.
Thank you, John.
Thank you. Bye.
With that, I will close, and please keep a look at your inbox because we got more webinars coming. We're going to have a couple more. We have a couple more already in the pipeline for next week. Please, everyone, have a safe and healthy Passover, a safe and healthy Easter, and we'll see you next week.
Take care.
Bye.